How do genetics impact co-occurring conditions in ASD? Have you ever wondered how our genes can influence the challenges faced by children with autism spectrum disorder? Genetics play a big role in determining not just autism spectrum disorder itself, but also the additional conditions that may arise alongside it. Many gene mutations associated with autism spectrum disorder also increase the likelihood of other medical and mental health issues. Common co-occurring conditions include seizures, gastrointestinal problems, immune system irregularities, and intellectual disabilities. Children with autism spectrum disorder may also experience other neurodevelopmental or mood disorders, such as attention deficit hyperactivity disorder. Autism spectrum disorder is genetically diverse, meaning it can involve both inherited traits and new gene variations that arise spontaneously. Some genes linked to autism spectrum disorder overlap with those related to other conditions. This overlap can help explain why certain disorders often appear together with autism spectrum disorder. For instance, genes that affect brain development and the regulation of neurotransmitters can impact emotional regulation and behavior. This can lead to the mental health signs often seen in children with autism spectrum disorder. The genetic complexity means that each child with autism spectrum disorder may show a unique combination of symptoms and severity levels. This diversity also influences how co-occurring conditions present themselves, highlighting the need for personalized care approaches. When it comes to emotional regulation and mental health, understanding the genetic factors can help identify early signs of co-occurring conditions such as anxiety, attention deficit hyperactivity disorder, or mood disorders. These conditions can affect a child's ability to manage emotions and stress, which are essential for building resilience. There are practical steps that can be taken. Early genetic screening can help identify children who may be at higher risk for specific co-occurring conditions. This allows for timely interventions that can make a difference. Support strategies can be tailored to address both autism spectrum disorder symptoms and related emotional or behavioral challenges. Collaborative care involving medical, psychological, and educational professionals can provide comprehensive support. Additionally, tools for resilience can focus on strengthening coping skills, emotional awareness, and adaptive behaviors, taking into account the child's genetic predispositions. In essence, genetics not only shape the core features of autism spectrum disorder but also influence the likelihood and nature of co-occurring conditions. Recognizing this genetic impact can lead to better identification and management of emotional and mental health needs in children with autism spectrum disorder.